Alright team, listen up. The patient is presenting with symptoms of acute bronchitis, epoxygenase, and Nintendo thumb. What do you make of this?
I think it could be a severe case of acute bronchitis, maybe exacerbated by some kind of allergic reaction related to the Sony PlayStation.
I'm leaning towards a possible inflammatory condition due to epoxygenase, but the Nintendo thumb symptom is throwing me off.
Hold up, Gary. What in God's name does the PlayStation have to do with any of those symptoms?
Nintendo and Sony are secretly the same company, make the same games, and use the same TVs. Might as well call it Microsoft Arm while we're at it.
Go outside and count rain droplets for a bit while we recuperate from that amount of contagious brain damage.
I'm not convinced. I believe it could be a rare genetic disorder causing these symptoms to manifest together.
I'm with Randall on this one. It might be something more complex than just a random combination of different conditions in video game consoles.
You're all wrong. It's Wolfram syndrome. Now, I want each of you to perform a microdotchectomy on the patient immediately.
Wait, are you sure about this? Microdotchectomy is a risky procedure?
I don't care. It's the only way to save the patient. Now get to it before it's too late.
It's too late. They just announced the Microsoft Switch 420.
Will you please shut the fuck up already? Tracy, I need to talk to you about performing microdotchectomy on my patient with suspected Wolfram syndrome.
Hold on, Hawks. Are you sure about this? You have been wrong before with such bold decisions.
Oh, piss. Right off with that crap, Tracy. I know what I'm doing.
I'm just worried, Hawks. You have a track record of being wrong on these hasty decisions.
You need to move on from the past, Tracy. This time I know I'm right. Trust me on this.
Fine. Proceed with the surgery. But remember, I'll be keeping a close eye on this case.
Keep an eye on Gary. He's acting extra stupid today, and I'm more worried I'm going to come to the wrong decision because of him.
What makes you say that?
I haven't figured out if I'm buying myself a PS5 for Christmas yet.
God damn it! I don't have time for this.
Oh no, the patient is in critical condition. We need to act fast.
It seems like microdotchectomy was not the correct treatment for Wolfram syndrome or Nintendo thumb, despite Dr. Hawks' insistence.
Why do you keep bringing that symptom up? You sound like a product placement guy at this point.
I don't get paid enough as a doctor.
You probably shouldn't be paid at all for your performance. Anyway, what should the correct treatment be then? We can't afford any more mistakes.
Let's not panic just yet, Randall. We need to stay calm and focus on finding the best course of action. I'm sure we can come up with a good treatment plan for the patient.
You idiots nearly killed our patient with your incompetence. Wolfram syndrome was a misdiagnosis and microdotchectomy was absolutely the wrong treatment.
What do you think the correct diagnosis is, Hawks?
Yeah, we need to know how to proceed and correct our mistake.
Please tell us, Hawks. We need your guidance.
We messed up, but we can make it right if you tell us the correct diagnosis.
You're all a bunch of morons. I can't believe I have to spell it out for you. The correct diagnosis is Maffucci syndrome. Now fix what you broke and don't screw up again.
Typical sexbox players, all rage, no skill, no bitches.
Guys, I'm convinced more than ever that it's time we put Gary up for adoption on eBay.
Just ignore him. The more we pay attention to Gary, the more stupid we become. We have a patient to focus on and a diagnosis from Hawks that he's going to declare also incorrect in a few minutes.
So how are things going in oncology department lately?
Pretty good, actually. Some positive responses from my patients, which is always uplifting. How about you? Any interesting cases on your end?
Yeah, I have this one patient that has been baffling me for days. It's like a medical mystery waiting to be solved.
Well, you always do have a knack for solving those mysteries. I'm sure you'll get to the bottom of it soon.
Wait a minute. I think I've got it. It all makes sense now.
Oh, all right. Good luck, Hawks. Let me know if you need any assistance.
Come to think of it, I do have an extra annoying tumor on my team we should remove before his stupidity spreads.
Why won't you just fire him at this point?
Vain hope, I suppose. Sorry I'm late, guys.
Had to rush in with this new diagnosis.
Hawks, where's your protective gear? You can't just barge in here like that.
This is unacceptable, Hawks. We have protocols for a reason.
Listen, Wolfram syndrome was a misdiagnosis. Dr. Johnson and I figured it out over lunch.
What are you talking about, Hawks? What's this new diagnosis?
Pterocephaly. It's a rare genetic condition causing abnormal head shape. Prognosis. Not good.
How did you come up with this, Hawks? It's unheard of.
Believe me or not, the evidence is there. We need to start treatment immediately.
I can't believe this. We'll have to inform the patient's family right away.
They don't have a family. I recognize them from...
If you say anything related to video games, I'm gonna toss you out of the ambulance helicopter.
I recognize them as possibly being related to you based on leaked photos from your childhood.
A deal's a deal, Hawks. Guess the helicopter rests its blades another day.
Tracy, I have to admit I was wrong about the diagnosis. It wasn't Wolfram syndrome, it was actually pterocephaly.
What a surprise, Hawks. Congratulations on finding the correct diagnosis for the patient.
Thanks, but this whole ordeal could have been avoided if I didn't have such idiotic doctors to work with.
You were the one who declared the wrong diagnosis in the first place.
No, my doctors are complete idiots. They did absolutely nothing to find the right diagnosis, especially Dr. Gary, who was more obsessed with Nintendo Thumb than Jack Thompson was with Grand Theft Auto.
Stop shifting the blame, Hawks. You need to take responsibility for your mistakes.
Scoff's fine, whatever. I'm leaving.